UBC, inspiring Uganda.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Good evening to you, our beloved viewers. You're welcome to the DOCtalk show. We are very excited to have you this evening. We are always glad when you join in every Thursday at 9 p.m. This is a show where we always talk about real health solutions to real health problems. Our show is proudly sponsored by the Ministry of Health, Uganda, and Kamara Men's Collection. If you have an event, if you're a gentleman and you have an event, you want a suit, please take time to reach out to them. They'll give you the best outfits. Did you know that every day countless Ugandans experience different medical emergencies? And did you know that most of them do not make it to the hospital or die within a few minutes after arrival to the medical facility? This is because most of us do not know what to do when faced with medical emergencies. So tonight we are going to talk about pre-hospital emergency care. And with me in studio, I have doctors that are very passionate about emergency medicine. They will tell us and explore more about what to do when faced with an emergency at home, at work, at a hotel, in a meeting, who to call, which is the most important thing, and how can we help this patient survive. So Dr. Kamara, you're welcome, and Dr. Umal, please introduce yourselves to the viewers.
Thank you, Esther. Good evening, our viewers. My name is Dr. Kamara Ivan. I'm a medical doctor at Mulago Hospital. Thank you for having me.
You're welcome.
And hi, my name is Umar. I am a pre-hospital practitioner, and I do work with a team called Mamanam.
Thank you very much, doctors, for that brief introduction. We are going to dive straight into the topic for the day, which is pre-hospital emergency care. Dr. Umar, please tell us more about what this pre-hospital emergency care is.
Thank you, Esther. I think pre-hospital care is that care that we get out of the hospital. So we are the link that you get in case of an emergency from when an incident happens to when you get to the hospital. So it includes the response, the resuscitation. We have to make sure that we preserve your life to get you to a hospital where you can get definitive or the intensive care that you need.
Thank you very much. Dr. Kamara, last time you told us about the golden hour, and this is a very important hour in a patient's life after they've got an emergency. Could you please recap for us how important this golden hour is?
Yes, so we are talking about pre-hospital care today. So I want the audience to imagine that pre-hospital care involves anything that happens outside of the hospital. So this is in your home, in your school, in your office, in your car, if you've gone traveling. So this is what happens everywhere. And within this time frame, we have what medically we call the golden hour, which we talked about last time. So the golden hour is the first hour after you get an injury or an illness. And what I would like the audience to know concerning pre-hospital care is that you don't have to be a doctor to save a life. So it sounds inconceivable, right? It sounds like it's impossible to imagine, but it's actually possible. So pre-hospital care involves you, me, bystanders. It involves all of us, and all of us can participate in pre-hospital care.
Thank you very much, Dr. Kamara, for that. So we know of some common emergencies that happen Imagine someone faints at your workplace, maybe during a presentation. What would you do? Who would you call? How do you recognize some of these emergencies? How do you tell maybe this person has fainted because they have low blood sugar levels? Dr. Umal, how do you recognize some of these common emergencies?
So common emergencies is we are going to look at what could be life-threatening to qualify as an emergency, so a medical emergency. So if someone has fainted at work, like Dr. Esther said, there are so many things that we are going to have to first do to consider if they're actually responsive or not responsive. So do you know anything about this person? If they're an elderly person that you know about office and you know they're diabetic, then chances are it could be their blood sugars, right? But that does not matter. What matters is, do they have a pulse? Are they breathing, right? Those are going to be the most two common indicators of an emergency, mostly in a workplace, that is an emergency that is non-traumatic, or that's not been caused by an accident. So how do you check if they are breathing? Of course, you can put a finger around their nose, or you can watch if their chest is moving up and down, or you can just tap them and ask them, hey, Esther, are you okay? If they are not responsive, your next part is going to make sure that you feel for pulses. Why pulses? Because this is a big indicator that their heart is still functioning and their heart is beating. So you just have to press your fingers around their wrist, right? Press hard. If you can't feel it, the best way is come and put your fingers on the side of their neck. Press a little bit hard. If you do not feel anything, then that means that that person is in trouble and they could possibly lose their life. So then you activate your EMS or your emergency network, call for help, and then start chest compressions as fast as you can.
So it's a very scary situation when someone
Right.
just collapses at work, right? So for our audience who are maybe don't have medical training, I want us to take it back to the first step.
Right.
So if someone just collapses on you, the first instinct you have is to call someone to see if there's a medical person around. Some people try to maybe call doctors they know, or they
Yes.
call nurses they know, which is a good first step. Try to call a doctor if you know, or you try to call an ambulance service if you know one, to walk you through. Even if you're going to do some of those steps, it helps to have someone to walk you through. And then, like you said, if you don't have a medical person with you and you can't reach one, what Dr. Umar has said is very important. You need to have the knowledge yourself on how to check for a pulse, how to check whether the person's heart is still beating or not, and which you have to put your hands on the side of the neck. So there's a proper position to place your fingers, but it is on the side of your neck. You place your fingers on the side of your neck, and if you feel that pulsation, then the person's heart is still beating. Yes. Now, if you don't feel that pulsation, so that's a different story. You have to begin what we call CPR. CPR is cardiopulmonary resuscitation. And for someone who doesn't have medical training, there is a basic but very effective and very important CPR, which we shall talk about later in the show.
Thank you very much, doctors, for that great input. I hope we have learned how to recognize some of these common emergencies, how to check if the person is actually still, if the person's heart is still pumping. So we are now going to take a short break. When we come back, we are going to talk about what to do when faced with these particular emergencies. If maybe it's traumatic, what are you supposed to do? If it's maybe the patient has just suddenly collapsed, what do you do? Who do you call? Thank you very much. Stay tuned.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Looking for instant excitement? The Uganda National Lottery Spin for Cash game is now available online. Wherever you are, you can join the excitement for just 500, 1,000 and 2,000 Uganda shillings. Don't miss out. Register now on www.nationallottery.go.ug for a chance to win your share of 2 billion instantly. What are you waiting for? Play Spin for Cash now, anytime, anywhere. Ituba is the proud operator of the Uganda National Lottery.
Uganda National Lottery. Dream, play, win.
Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Tuba Uganda and regulated by the National Lotteries and Gaming Regulatory Board.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from the short break. We are now going to look at what our responsibility is as a normal Ugandan, not as a medical personnel. As a normal Ugandan, what can you do to make sure that you save someone's life before they get to hospital in case they have got an emergency? So how can we prepare actually also for these emergencies at our places of work? What are those basic things that we need to have at school, in the gyms? We have seen people fainting on stage during like a concert. We have seen people fainting in gyms while just working out. So how can we save these people? What can we do? How can we prepare for them? So our doctors are still going to take us through how we can go about this as normal basic people, because we know that an accident or an emergency can happen at any time, and we just need some of these basic skills that we can use to help these people. Dr. Umal, what can one do?
I like that you mentioned that emergencies can happen to anyone and everywhere, regardless of who you are. We've seen 2-year-old or 2-day-old babies suffer emergencies, respiratory emergencies. We've seen people suffer emergencies in the gym. And I like that we bring different disciplines to the table. My discipline is mostly out of hospital. So it's limited resources, and it's going to really depend on the skill and the knowledge you have. So we have identified, the first key is that we have identified that this is life-threatening, right? So it's an emergency. 2, the next thing that we are going to do again, we activating or calling for help. It doesn't need to be a doctor. Emergencies are very hard and high pressuring situations to deal with alone. I'm sure you see that even you guys in hospitals, right? So even out of the hospital, in your home, call someone else for help. Hey, we need some help. Come in here, I need some help. And then you start, checking this patient. Do they have a pulse, for example? And there are several ways you can check for a pulse. Again, we said a pulse is going to be the indicator that this person's heart is functioning. And again, why do we need their heart to be functioning? Because it's the heart that transports the blood that their brain needs. In all these emergencies, the first thing we need to take care of is the victim's brain. And how do you take care of that? By doing CPR. Is this person breathing, right? Do they have a lot of things in their mouth, in their nose? Turn them on the side, not just the head, turn the whole body on the side so they can sleep on their side.
Can one be turn the patient to any side? Can you turn the patient to the left side? Can you turn the patient to the right side? Which side specifically?
Dr. Kamara here will tell you, which side do you prefer?
So the ideal is to turn them onto their left side, but it depends on what's going on. If you have a trauma, for instance, if you have an injury on one side and you cannot lay them on that side, you could use the other side. But ideally, you should turn them on the left side. Yes.
And again, the idea on the left side is that you do not want, if you turn them on the right side, their heart is on the left. You do not want blood, again, because their heart, we're assuming that their heart is not working. You don't want the blood to work going up. You want it at least to be going down, to drain air. But mostly also their airway, because again, we said their heart and then taking them air, right? And that's why we start CPR. Now, we've recognized that this person doesn't have a pulse. Then we start chest compressions. If they do have a pulse, you do not have to start compressions. You just have to position them well to make sure that, okay, are they breathing now? And their breathing is going to say, of course, as the chest moving, you might, if it's an emergency and it's in a controlled place, you might want to open up, their chest. Of course, preserve their modesty, but open up their chest so you can see if it's moving up and down. That's a good indicator that they're breathing. If it's not, that means that person is not breathing, right? And also, what the condition of that? Is it a pregnant mother? Usually for pregnant or expectant mothers, we want to put them on their side so that blood can flow all the way, and blood can return so that it's not obstructed and things like that.
Yes, now that you mentioned the pregnant mothers, the question she had of, do you turn to the right or to the left? So this is very important in pregnant mothers.
Right.
So turning them to the left, we always tilt them to the left. Even in the hospital,
Right.
when we are, if a pregnant woman is undergoing surgery, or even just in the hospital for any other reason, we normally put them on the bed slightly tilted to the left, because when you're slightly tilted to the left, you're less likely to, for a pregnant woman, the uterus that is very big now with a child in it is less likely to compress on the inferior vena cava, the blood vessel that's going to take blood back to the heart and from the heart to the brain. So the question of left or right somehow becomes important in pregnant
mothers.
Yes, surprising.
And again, the purpose for this is the positioning so they can breathe well, right? And then to make sure their heart goes. Now, be very careful when you're turning patients or when you're turning victims in case of emergencies. Because remember, when someone is unresponsive, they lose control of the entire body, and we have to protect their neck. And that's why it's very important for you to have more than one person, right? So as the other person turns them, you're making sure that you're protecting their neck. Now,
why, Dr. Umal, why is it very important to protect the neck, especially with these trauma emergencies? Like someone has got an accident, but you're trying so much to protect the neck, or maybe their back, to make sure that sometimes people get accidents and break their limbs, or maybe get accidents, but they still can't feel their legs anymore.
right.
Why are we considering making sure that we protect the neck or their back?
I think the idea is that our brain starts, and our brain is in our heads. That's what we know. But the brain has a continuation that comes down our neck through the bones of our vertebrae column, right? That goes down and supplies all the way to the trunk.
That's in simple terms the backbone.
The backbone.
Yeah.
Oh, yes, the backbone, like we call it. Now, every time there's that bone, the way those bones are made, they have like a hook that if you do not position this patient well, that hook could break and then pierce and break their bone and their spinal cord. And that is more dangerous than them, because that means that person will not walk again, and that could also stop them from breathing.
Yes.
So it's very important that during these emergencies, we don't cause more trouble. That's why we want to protect that patient. Mostly patients that have been in accidents. You've seen the common practice of people being thrown under the patrol or under a car. It is important that we keep their necks aligned. Just hold it until help gets there. And you can do all the other things by the while holding their neck, even on the side. Now, unless they're having a cardiac arrest, because, and how do you know? You feel their pulse. Now, if you feel and they don't have a pulse, then you do not have to turn them over. You can just, adjust their neck in a way that it opens, just like they would breathe normally. So I keep telling people, even if this person is lying down on the floor, imagine like they would be standing, and if they do like this, they're blocking their way. If they do like this, they're blocking their way. Just keep their head in a neutral position as someone else is doing CPR.
This is a common question that people ask when they witness accidents. People get confused. They say, so there's someone lying there in front of you, or there are people lying there in front of you, an accident has happened. Should I move the person, or should I just leave them where they are? Because it's really, it makes sense to be afraid that you might cause further injury, or you might do something wrong. So this brings us to the point he said about stabilizing the neck. So the consensus is that you move the person only to get them away from further danger.
Right.
If they're in the middle of the road, pull them to the side of the road.
Right.
If they're close to a fire, pull them away from the fire. If they're in a very busy place,
Then water.
Yes, they're in water, pull them away. If they're in a very busy place and people are going to walk all over them, pull them away. But after that, you're better off just leaving the person, just stabilizing, protecting the neck, and leaving the person where they are.
What would one do if this trauma victim is profusely bleeding? What would you do if they have got a fracture? What would one do?
So there are three things. Make sure that the patient is breathing, which is what we call the airway. You make sure their airway is open and they're breathing. Those are two things, airway and the breathing. And then make sure that they're circulating. They are not. Now, if this patient is bleeding, you have to stop the bleeding first before anything else, mostly in profuse bleeding. Because bleeding kills. Bleeding is going to kill them, and it's going to give them these other complications. So how do you stop them from bleeding? Again, allocate and identify how many bleeding sites do they have, right? And then go to a one that is bleeding mostly. Now, say, look out for those that have big bleeders, and you have to be medical for that. Now, you don't have to be medical to say that this bleeding is more than this bleeding. So if I cut myself on the finger, that is not life-threatening, right? But if someone cut my hand, it's going to be bleeding. I'm going to apply pressure. The first thing to do is apply pressure and then see if that stops the bleeding. If it doesn't stop the bleeding, apply more pressure with a piece of cloth or a clean piece of cloth or anything that you see that could hold that blood. And if it's still, this person is bleeding profusely, get a tourniquet. And a tourniquet could be a belt, it could be anything that you're going to put above the bleeding site. I'm assuming it's the hand. If it's the leg, it's above wherever that it's bleeding.
Yes.
About, give and take a decent distance, that, and then tie tight. Now, when you're tying, depending on what you have, please avoid tying using strings, using very sharp, very thin objects, because that will cut through the skin. What we like to do is get something that is bigger, and then you can use that to squeeze tighter until that bleeding reduces or stops.
Something, you mean something maybe wider, not very thin and
yes, and not very thick, because if you get something too thick, like a sweater, that will not occlude the vessels, right?
Yes.
But you need to get something like a belt, something that is, a mini rope or something that it's not going to cut into the patient's skin when you go as tight, because the idea is that we are going to go as tight as we can to make sure that we stop the bleeding, because again, like Dr. Evans said, bleeding kills.
Yes, and also for if you're a medical worker and then therefore you have more training, it's ideal to carry a tourniquet, right?
Yes.
Because with a tourniquet, this one is an elastic that has markings. So you can pull it as tight as you need to, and then when the bleeding has stopped, you can loosen it slightly, because you're supposed to loosen it after some time, right?
Yes, yes.
If the bleeding stops after some time, to preserve, to allow the other part of your limb to get blood supply, you're supposed to loosen that tourniquet after a while. So which is easy to do when you have a real tourniquet.
And of course, the fear is that we are going to kill that part of the body. It is not that easy to kill. And that's why this is not definitive. You are putting this tourniquet, want to stop the bleeding, but till they get to the hospital. So maybe it's important, when you can, to allocate the time with which you put that. So say approximately 12 past midday or 12 past 1, in that the doctors know in the hospital, because you guys would want to know how long has this tourniquet been on before we give this person more or before we release it.
Yes.
But the most important thing is stop the bleeding. The first thing is apply pressure. Now, make sure your hands are covered. Of course, it's important to make sure you apply pressure with with like a piece of cloth. If you have it, apply and squeeze, assuming this person doesn't have a fracture. If you see that there's obvious signs of a fracture, because that's going to be very painful, again, you go and apply the same concept above the fracture or above the wound. Thank you very much.
Thank you very much. I hope that we've all noticed that we all have a role to play in this, because an emergency can happen to anyone, regardless of your financial status, whether you're a medical personnel or not. Thank you. We are going to take a short break. See you, and please stay tuned.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from the short break. We are still looking at the pre-hospital emergency care. And without forgetting our sponsors, Ministry of Health, Uganda, and Kamara Men's Collection. So how do we prepare for these emergencies? The different places where we stay, in our homes, at our workplaces, in the different schools or universities that we go to, at the gym. How do we prepare for these things? Do we need particular equipments like a first aid kit? Our doctors are going to take us through this.
I like that we're talking about this because this is very crucial. What I usually tell people is that we cannot, much as we cannot prepare for emergencies, we can be prepared when emergencies occur, because we know by now it's not a matter of if, it's a matter of when, right? So it's very important. Now, where do we congregate? Where do these emergencies happen, right? In medicine, we call it the determinants of health. So what are the determinants of emergencies? And that's why, if you guys remember back then, every taxi had a red box. Do you guys remember that? Where they would put like in a like a matatu or taxi, there's like a red box. And that red box, the purpose was that in case an emergency happens, you see, they're not saying if an emergency happens, right? We know it might happen, the fact that we're on the roads, but in case it happens. So where do we congregate, or do these emergencies happen? In schools. What kind of emergencies do you see in children? That will indicate how to get ready. It is important for us to have a certain, even if there are 5 rules, we call it protocol. What do we do if there's an emergency in the office? Now that we know what an emergency is, who do we call, right? Who is responsible? These things should be allocated at workplaces, because emergencies, you've seen emergencies, people get cardiac arrest in the parliament, right? If it happens, because we know in hospitals, you guys have a protocol for everything. We should take the same and then take it out of hospital into community, into churches, into schools, into hotels, into our homes as well, right? We need to be prepared. Take it to your maid and tell them, if this happens, I want you to do A, B, C. And one of those should be calling you.
Yes.
The first on the list should be, let me know, so that you can get all your resources ready.
Yes, so preparedness is key in managing emergencies. So I always like to think that you may not have access to an ambulance service, you may not have access to a hospital sometimes, but what you do have access to is knowledge and preparedness and prevention. Those are at our fingertips. Those we can all have.
Right.
Yes, so knowledge is very important in preparedness, and that's where we come in to help you, to teach you how to recognize emergencies and the things that you can do.
Yes. And also, I should mention this whole notion that we've had saying, the government has not done enough, or we don't have enough. The government will not come into your community to the last door, right? The government has a system that will help you when you get to the hospital. But what do you do? And again, let me go back to the golden hour for a second. In pre-hospital, the golden hour doesn't need to be the hour. It means the events that happen, most importantly, in the first hour. So the golden hour could be the time it takes for response to get there, right? In case you have emergency response or EMS response. So that means, well, in other communities, it's 6 minutes. 6 minutes at most till help gets to you, professional help. So that becomes our golden hour. What you do in that golden hour, we have talked about. But what should be in place, right? That's why I said that set of protocols that should happen, that, okay, in case we get a cardiac arrest, or in case we get any kind of emergency, either call the manager, call the police, and then do A, B, C, D, E, right? I feel like that's very important.
Yes.
To put across.
Thank you very much. Dr. Kamara, you had something to say.
Oh, I was going to emphasize what he said about the first aid box that you used to have.
Yes.
So it looks like a simple plastic box, but it's really, it contains items that can save life or save a situation. So it's something that, for instance, this is something that anyone can have, and it helps them. Yes. So preparedness is really in the hands of everyone.
We are now going to look at what a first aid kit is. What are those important things that we must have in a first aid kit?
So right now I'm going to dive into something that everyone should have. Every home, every office, every school, every car should have. And that is a good first aid kit. So this is a basic first aid kit. And if you don't have one, then this episode is for you. Or if it's long since you restocked your first aid kit, this episode is for you so that you can remind yourself of what's supposed to be in a good first aid kit. I'm going to walk you through each item, what it's used for and why. Okay, so first off, we have medical gloves. Okay, so this is to protect yourself and protect the person. So just in case you're dealing with someone who's bleeding, or you someone who's maybe vomiting or something else, you want to protect yourself and protect that person. So you use medical gloves. And then we have items for wounds and cuts. So we have small plaster strips for small wounds. And then for larger wounds, we have the larger bandages. So these are non-adhesive bandages so that they do not stick to a wound. So you use this bandage and tie it on with a crepe bandage. So we also have a crepe bandage here. So now for wounds that are even larger and bleeding even more profusely, then we use gauze pads. Now there are no gauze pads in this box, but gauze pad, you can buy gauze and make the gauze pads yourself. So the good thing with a first aid box is that you can create the first aid box yourself. So all these items, you can restock all these items yourself, and you can customize your first aid box according to the situation and to the event. So like I said, this one's a basic first aid kit. But if, for example, you're a medical worker, you're a doctor, or you're an emergency physician, you can have a first aid box that's customized to the extra skills that you have, that has even more than this. So let's go on. Then before you put a plaster or a bandage on, then you need to wipe the wound. So these are cleansing wipes. These are antiseptic wipes. This particular box also has some soap wipes, which is just plain water and soap to wipe on the wound before you cover it with an adhesive bandage or with a plaster. Then in a first aid box, we also have some medications, okay? So here we have some painkillers. It's good to have painkillers for both adults and children. Here we have only for adults, but you can also have a painkiller for a child, like a painkiller syrup for a child. You just have to make sure that that you know the dosing. So with children, when you buy the medication from the pharmacy, you must make sure you follow the dosing that's given to you in the pharmacy. So we have a painkiller here, and then we have painkiller sprays as well. Painkiller spray. This is very good for if you get sprains or joint pains or muscle pains. This is a painkiller spray. And then we have ORS tablets. So acute stomach infections or acute food poisoning is a very common thing to happen. Now it may not be life-threatening, but it can be very inconveniencing, very disturbing. So these are ORS tablets, which you drop in a cup of water, and you can take the ORS fluid. And as well, this first aid kit has an antibiotic still for acute food poisoning. So now, personally, I never travel without an antibiotic for acute food poisoning. This is a very important part of the first aid kit if you are traveling. So if you get acute food poisoning, you just take one tablet, and that can help you until you get medical advice. And then here we also have some safety pins, and these are handy for the bandages that I showed you earlier. So if you have to use a bandage like this one, okay? If you have to use a bandage like this one, then you will need safety pins. When you wrap the bandage around a bleeding wound or a bleeding arm, then you need safety pins to strap it into place. Here we have a cold pack. These are cold packs that come already made. So you squeeze it and it turns into a cold pack. And this is for applying to injuries. This is good for injuries, again, joint injuries, muscle injuries, fractures. So when you get that, you apply a cold pack to stop the wound to prevent pain and to help with healing. So now if you don't have the already made cold packs, there's something else that you can use. So these are ice packs, so ice bags. And these you can use if you're at home or somewhere where you can get ice, and put it into the bag and then place the bag on the injured part. So you can fill it with ice and then place it on the injured limb, or you can place it on your head or anywhere where you have pain and swelling. So then also here we have some disinfectant wipes. You can have disinfectant wipes, or you can have your regular disinfecting alcohol with you. Lastly, in this kit, we have a triangular bandage. Now, triangular bandages are for supporting limbs, specifically supporting arms. So if you have a fracture on anywhere on your arm, then you apply a triangular bandage to keep your limb in position, to keep the pain down, and to keep the fracture from getting worse until you get to the hospital. So there you have it. That's it. This is a basic first aid kit. However, like I said, first aid kits can be customized to the situation and to the person carrying the first aid kit. Oh yes, and another item here we have in a first aid kit is a pair of tweezers. Now these tweezers are not for eyebrows, like you know. These tweezers are for if you have glass or pieces of wood or something stuck in your skin, or maybe there's a child that has put something in their nose or in their ear and it's visible enough for you to take it out, then you can use tweezers to take it out. So here we have a tourniquet, which like we had talked about earlier, you can apply to a limb to stop bleeding. You apply it above a bleeding point and tighten it to stop bleeding. So if you're a medical worker and you know how to use a tourniquet, you can have a tourniquet with you. And then this is a CPR mask, which again, if you're a medical worker and therefore you're trained to do CPR, you can have this as well to help you to do CPR in a safe way. Also here we have some trauma shears, which come in very useful for cutting clothes. So when people come to the hospital, sometimes you need to cut off the cloth without disturbing the person, without moving the person a lot. So this comes in very handy for that, and cutting any other object. And then you can also have, if you're a medical worker, you can also have some IV cannula in. You can have some plaster, some strapping, and other emergency drugs like adrenaline. You can have much stronger pain medication that's prescription only, like fentanyl and morphine. But this is the basic first aid kit that anyone can have and everyone should have in their home.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Crafted with precision, designed for brilliance, Supreme Wave pens reach the hands that shape tomorrow. Only a Supreme Wave delivers expression this pure. In every stroke, confidence flows. Because greatness isn't guessed, it's written. Supreme Wave, write your future.
Supreme Wave are the best.
Oyo ye DOCtalk sega wanga chaguze emyaka namwe 3 May ku National Theatre. A lifetime of melody concert, 43 years of DOCtalk Segawa performing in Kampala for the first time in a long time. Enyimbo boba dowuli ampulire kati jangu DOCtalk Segawa hazikuyimbire. Tickets eya gold ya $15 ate VIP ya $30. Booking a ticket yo ku noti 765 587 225 oba ku www.carrytickets.com oba ku National Theatre. Ono ye DOCtalk Segawa 23 May 2025 ku National Theatre, celebrating 43 years of DOCtalk Segawa. Bitutusibwako Charism, UNCC, UNMF, Statewide Insurance Company, UCC, Riz Medical Center, Donjo Fashions, Hot, Q Vibes, ne Carry Tickets.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short break. So now that we have seen what is supposed to be in our first aid kits, we are now going to look at how to do CPR. What is CPR in full as cardiopulmonary resuscitation? So Dr. Umal is going to take us through what CPR is and how to do CPR.
Thank you, Dr. Esther. I think it would be important before we talk about CPR, it would be only fair for us to talk about what goes on in a normal heart, right? Think of a heart as a pump. The role of the heart is to pump and distribute blood to all the vital organs of the body. Now, there are so many organs in the body, but they are what you call the vital organs. And in those vital organs, I want to really pick out three, being the heart itself. The heart is a very selfish organ. Before it pumps blood to itself, to the body, the rest of the body, it has to first serve itself. So think of it as a chunk of muscles that needs to supply blood so that it can get what it supplies to others. Two, the brain. The brain is the controller of your body, and the brain does not have as much time. The brain has a maximum of 5 minutes. If you lose blood supply to your brain in 5 minutes, chances are you will not come back, right? And then three is going to be the lungs, because again, we know where blood picks its oxygen. Oxygen comes from the lungs. Now, if that pump has failed under normal circumstances, the only thing that is going to save this victim, this patient, and please note, this could be your husband, this could be your child, this could be your boss, this could be anyone, because we've seen that this could happen anywhere. This happens in the gym, it happens in a taxi, like it could happen in hospitals. So we're going to talk about CPR and the essence of CPR. Three things before we talk about CPR. It's important that you start CPR as soon as you can't find a pulse, right? Start CPR. Two, it's important to not be disrupted once you start CPR, because again, we said the heart is the pump. And remember, this pump has failed on its own, so it's going to be you pumping for it, right? And then three, and very importantly, do not stop CPR until professional help comes, or until this person comes back to life. So those are your only three targets that you're going to consider. So what is CPR? CPR is cardiopulmonary resuscitation. In layman's language, it is the act of pushing onto someone's chest. Now, I want you to imagine a balloon full of water. Imagine that balloon is connected to a straw into another balloon. The idea is that we push with force blood out of this one balloon through the straw into another balloon, right? So how do we do that? We know that the heart is located in the center of the chest. So where you feel the collarbone, or before you come down to your stomach, right here in between your breasts, because every man or every woman has breasts. So in between that, you lock your hands just like this, okay? Lock your hands. I'm gonna stand up for this. Put your hands on the patient's chest. And now this patient should be lying, looking upwards, right? And then, so you lock your elbows, and then you lock your shoulders, right? And then you're bowing down, and then you're pushing. 1, 2, 3, 4, in that rhythm. Why is it important for you to count? Because again, someone will breathe for you, like Dr. Kamara said. If you have 2 people, heart attacks are best managed by a team. That means a team is more than 1 person. So as you are either stabilizing the patient, keeping the patient's neck stable, or making sure that the patient's head is in position, in the neutral position that we talked about, to take in air, the other person is pushing or doing CPR. And you see why it's important to have 2 people, right? Yes. Because in between CPR, you're going to have to check pulses, check pulses as someone else is breathing for the patient, and then continue doing CPR. That's why we said that the first thing to do is activate or call for help, do CPR until this person comes back to life, or until help comes your way. That's CPR for you.
Thank you very much, Dr. Umal. Now we're going to have a simple illustration of how this CPR is actually done. How deep do we push? Like you said, we lock your hands. So how deep do we push?
So the idea is that we are supposed to push at least 2 inches deep. Push 2 inches deep and then allow for recoil. Again, why do we allow for recoil? You want blood to fill into the heart from the lungs and then fill back. We're assuming it's going to the brain. So assume it's not going anywhere else. That's why this patient has to be lying flat on a hard surface. So preferably on the floor or on a wider bed that is not as bouncing if you can't get them down the bed. So again, the concept is push hard, 2 inches in. Now, don't be afraid of breaking this person's ribs, because after all, they could be dead or they could not be coming back. So that will fix. That's why pre-hospital ends in the hospital. So don't push with the intention of breaking their ribs, right? Push with the intention of beating for their heart, because their heart has lost a heartbeat and you're the one that is beating for it. And then whenever help comes, help will come with the technology and the medicines that they need to take over to help bring this person back to life. Please note that we are taking long to explain this. This happens in like 2 seconds. So in 2 seconds, you've seen that this person is not breathing. In 2 seconds, you've seen that this person does not have a pulse, and you've initiated CPR as soon as you can.
Now that we know what pre-hospital emergency care is, who do we call as we are doing the CPR, as we are arresting bleeding, as we are splinting fractures? Who do we call so that we are able to transport this patient to a health facility? Now, the doctors we have in studio today are again going to tell us who are the go-to people. What numbers can we use to call these people? Dr. Kamara.
We urge every community, that is every institution, every school, every office, every home, to have a focal person that they call in case of an emergency. This is very important, to have a person that's specifically in charge of that. So for instance, in a school, and this happens in the school where my children go. So in the school, for instance, there is a contact person in every class. So in every class, there is a parent that you call in case there's an emergency. There's a person specifically for that role in the whole school. So it is highly recommended that you always have a person specifically put in place to call when there's an emergency. Now, this person, of course, will have more information. They'll maybe be the ones that have access to call the other helplines, maybe the ambulance services or the hospitals. So that is highly recommended. And then we have in our medical services, we have structures. We have the government structure and we have the private structure for handling emergencies, which Dr. Umal is going to add more on.
I think, like Dr. Kamara said, emergency response should be a community initiative, right?
Yes.
Before help comes. So have a focal person, like Dr. Kamara said, very important. I would recommend that have a medical focal person, right? Because again, they can give you instructions on what to do. Exactly. They can walk you through the emergency as help gets to you. So that's very important. 2, we recommend, so the government has done some work to put in place responses or structures that will lead to the response, right? And that starts with the regional dispatch call centers. As of we have right now that the functional dispatch centers are being worked on, I think, in every region. But what the government has said is every district hospital has an EMS commission or an EMS committee that is instigated to respond and help in cases like that. So we'll put the numbers on the screen for you, depending on the district. We'll find them and then put them for you, but activate them. These are going to be very important because then they are going to come with an ambulance. Part of pre-hospital care is emergency transportation to the hospital. So please use those resources, right? 1, 2, there are also private ambulance resources that you can reach out to online. Look up who is licensed. It's very important to go with someone that is licensed because then you can check the quality. I mean, emergency is one of those conditions, one of those situations that you want to be sure who is giving you care, right? Because your life will depend on that. And then 3, again, it doesn't hurt for you to be prepared. So much as there's a government structure, there's a private structure, you should have your own community initiative on what to do, who we call that focal person. If you have to pay them a fee to retain them, please do. And make sure that, you do drills with them and then simulate emergency cases, because again, you never know when one is going to show up.
Thank you very much, Dr. Kamara and Dr. Umal, for having spared time to teach us about the pre-hospital emergency care. And to our sponsors, Ministry of Health, Uganda and Kamara collection. We are forever grateful. I hope we have learned something today. See you next time every Thursday at 9 p.m.
This message is from the Ministry of Health with support from partners.
UBC, inspiring Uganda.
Agriculture is Uganda's economic backbone, employing about 70% of the working population and contributing 20% of the GDP. As the world becomes a digital global village, ICT has proven to increase productivity in the agricultural value chain. UCUSAF, through its Strategic Plan 3, recognizes the importance of access and usage of ICT-based tools, information and knowledge for farmers by providing them the needed skills to live, learn, work and participate in a digital society.
We came up with a project which we took to UCSAF, and we're happy that UCSAF supported it. That project is called ICT for Farmers. What did we get from ICT for Farmers? We managed to skill up to 100,000 farmers.
When you want to relax your body and refresh your mind, welcome to Hotel La Confidential, Aroa's premier destination for luxury and comfort. The only hotel in Aroa City offering a serene atmosphere, breathtaking scenery. Come and discover our exclusive wellness club with packages that include a fully equipped gym, a rejuvenating sauna, steam bath, and a great sky blue swimming pool. For events, our state-of-art conference halls and versatile event spaces are perfect for hosting shows, wedding receptions, birthdays, and more. Come and enjoy our cinema hall and unisex saloon, all designed to meet your entertainment and grooming needs. Bring your family and let your kids splash around in our beautiful kids water park. We are located on Aroa Pakwachi Highway in the heart of Aroa City. Don't wait. Visit us on www.hotelconfidential.com or call us on 0761 688 181.
Hi, thank you for coming.
Thank you.
Oh, just a second. Where is your tax clearance certificate? You don't seem to have a tax clearance certificate, do you?
Oh no, I haven't filed my returns.
Sorry, we can't proceed without it. Can we bring in another bidder now?
Next!
Opportunities don't wait. Avoid penalties and interest by filing and paying your taxes before June 30th, 2025. Call our toll-free number or WhatsApp for help.
Uganda Revenue Authority, developing Uganda together. This week on UBC.
In 2016, President Yoweri Museveni visited Mount Zion Church, where he prayed with the congregation. During his